I am Dr. PK, a board-certified internist practicing in California for more than 30 years. These videos are for educational purposes only. Always consult your primary care physician. Today, we are moving to the left side of the heart to audit structural failures. We're auditing mitral stenosis and mitral regurgitation. They represent two completely opposite mechanical problems causing a fluid crisis. Think of your mitral valve as a critical internal checkpoint. It sits between your left atrium and your left ventricle. The left atrium holds fresh oxygenated blood from your lungs. The left ventricle is the main pump that sends blood to your body. It must open completely during filling and seal absolutely airtight during pumping. Problem number one, mitral stenosis. This is the tight gateway. The valve leaflets become thick, calcified, and physically fused together. Historically, the classic culprit is rheumatic heart disease, stemming from an untreated strep infection years or decades prior. Because the valve cannot open fully, the left atrium has to compress with immense pressure just to force blood through the bottleneck. Because blood backs up, the left atrium stretches drastically, which commonly triggers atrial fibrillation. Worse, the high pressure backs up into the lungs. Patients experience severe shortness of breath and an inability to breathe while lying flat. Some even cough up blood due to tiny ruptured vessels. Eventually, this overloads the right side of the heart, leading to fluid backup in the legs. Now contrast that with problem number two, mitral regurgitation. This is the leaky gateway. Here, the valve fails to close properly. Whether caused by a heart attack or chronic wear and tear, the result is the same. Blood leaks backward into the left atrium. This creates a double crisis. Your body receives less forward blood flow, causing profound chronic fatigue and weakness. Simultaneously, the left atrium is hit with a tidal wave of blood from behind, causing fluid to back up straight into your lungs. How do we treat these mechanical failures? While medications cannot reverse structural damage, they protect your remaining function. In mitral stenosis, we aggressively slow the heart rate down to give the heart more time to fill through the tight opening. If atrial fibrillation is present, we must use traditional blood thinners like warfarin to prevent strokes. In mitral regurgitation, we focus on afterload reduction, relaxing your blood vessels so it's easier for blood to move forward. When symptoms progress, mechanical intervention is mandatory. For mitral stenosis, a cardiologist can use a specialized balloon. This balloon physically cracks open the fused leaflets. For severe mitral regurgitation, surgeons strongly prefer valve repair. Repairing with a clip or ring maintains significantly better long-term heart muscle strength than a total valve replacement. Protecting your structural heart health requires controlling systemic metabolic inflammation and high blood pressure. To map out your entire cardiovascular prevention strategy, explore our complete hypertension and heart masterclass playlist. Download my 14-day smoothie weight loss plan, PDF linked below. Subscribe for evidence-based science and let nature help heal you.